This video is to give patients clear insight into what a total hip replacement procedure is, how and why it is done, novel developments in implant technology, and what to expect from your concerned doctors while opting for a total hip arthroplasty for better joint health and a better life. The hip joint is an imperative part of the human skeletal system. It bears weight and articulates movement. It takes constant dynamic load of the body while walking, jogging, and doing day-to-day activities that involve physical movement. Your doctor will analyze the condition of your hip joint through X-ray scans. For example, the first X-ray shown here is of a regular ball and socket of the hip joint. There is a wide space between the ball and socket, which is occupied by acetabular cartilage. This is normal joint space. In the second X-ray, however, the ball, or the femoral head, is directly rubbing against the bony surface of the hip socket, indicating that the space facilitating the acetabular cartilage has been eliminated. Observing that the ball and socket of the hip joint are in direct contact with each other, the acetabular cartilage has completely worn away. Hip replacement surgery, also known as hip arthroplasty, entails the removal of damaged components within the hip joint that are causing discomfort and dysfunction, subsequently replacing them with innovative materials composed of varying combinations of metal, plastic, or ceramic. The pivotal component in this intricate joint mechanism is the femoral head, located at the top of the thigh bone, femur, which articulates within the pelvic socket, known as the acetabulum. The femoral head and the acetabulum are protected with cartilage. This establishes the crucial ball and socket joint, vital for smooth and pain-free movement. Deterioration of cartilage due to factors like arthritis and injuries leads to the undesirable lack of cushioning within the joint. The bones begin to rub against each other, causing bone-on-bone friction, which results in pain and severely hampers everyday activities, such as walking and climbing stairs. To rectify this distressing condition, your surgeon is likely to advise a total hip arthroplasty, emerging as a definitive solution for osteoarthritis, rheumatoid arthritis, and avascular necrosis. The surgical procedure unfolds with a precise incision made by your doctor or physician in the hip area, facilitating the careful separation of muscles, cartilage, and tendons. Subsequently, the femur is meticulously detached from the acetabulum, allowing for the removal of damaged cartilage and osteophytes using Rimmer. Then, an acetabular cup is expertly positioned by your surgeon and secured with screws, following which a polyethylene or ceramic liner is inserted. Progressing to the femur, a strategic opening is created in the femoral neck to accommodate the placement of a fully coated or proximally coated stem with available ceramic or metal head options. Your surgical team would then verify the restored hip joint's range of motion, ensuring optimal functionality. The joint capsule is closed, the repositioned muscles are secured, and the incision is sealed, utilizing sutures and staples, thereby concluding this procedure. Your concerned doctor would advise various methods of recovery and encourage movement after affirming the success of the procedure.